almost 60,000 more deaths involving coronavirus could have occurred in England and Wales if white people faced the same risk as black communities. That's according to research by two leading think tanks. This programme has had exclusive access to the report by the IPPR and the Runnymede Trust. It says the increased risk of death for people from minority ethnic groups is due to a variety of factors, from overcrowded housing and income inequality caused by structural racism, and urges the government to take immediate action to better protect communities at risk. Our health and social care editor, Victoria MacDonald, has this report.
COVID-19 is no respecter of equality. You only need to look at these photos to see that. So what would have happened in the first wave if white people had faced the same risk as those in black communities? Two leading think tanks today say 58,000 more people would have died in England and Wales. Equally starkly, taking out the effects of age and sex, they estimate that at least 2,500 black and South Asian deaths could have been avoided.
Our research finds that actually underlying diseases like diabetes or cancer or lung disease aren't explaining what's happening here. They explain only a sliver of what is a massive inequality or risk disparity. Okay? Other people have looked to use genetics to explain what's going on. But again, the evidence is clear. Race and ethnicity are concepts defined by society, not by genes. And so the reasons why race and ethnicity are determinants of COVID outcomes are societal, not genetic.
There are the statistics to back up the report's findings. 24% of Bangladeshi households and 15% of black African households are classified as overcrowded, compared to only 2% of white households. Non-white patients are often sicker when they arrive at A&E. Black patients, 55%, and South Asian patients, 35% more likely to need resuscitation or very urgent care than white patients. Housing, healthcare and employment all pointed to in the report. Ranjith Chandrapala was a bus driver from West London. He died from COVID on May the 3rd. His route had started and finished at Ealing Hospital.
All of the bus drivers that I think of in, my dad's garage, there's definitely a high proportion of, BAME workers there. And I think that they were just used like fodder, really. They were asking for better PPE, they were asking for better safety measures, but there was such a pushback, I think. And why is that? It's because is it because there's a lack of respect for our communities?
30 bus drivers in London have died from COVID-19, and today Transport for London said they had followed Public Health England guidance throughout the pandemic and would do everything that is humanly possible to protect workers and customers, while the government said measures had been designed to protect and support everyone, including our most vulnerable. This is not the first report to highlight the disparities and who is being affected by COVID-19. In June, we had the Public Health England review, which some people were disappointed in because it didn't go into some of the underlying structural problems. And the government itself has ordered a review into that review. But this is not action. And the IPPR and Runnymede Trust both say that what is needed right now is action. And so they say this should happen. Include ethnicity as a risk factor when deciding who should be tested, offer temporary accommodation to people who need to isolate if they can't because of their living conditions, and ensure isolation pay support is available to all, including those without immigration status.
There's the issues about funding and how we allocate funding so that those people at greatest risk get the greatest impact and get the greatest measure of intervention. This is a leadership question as well. It's about who leads these programs and ensuring that we have representation of black and minority ethnic groups around the table when decisions are being made.
There are more facts and figures, of course. Public health cuts, for instance, in 10 of the most ethnically diverse areas in England and Wales. But in the end, this is what it means. Ranjith Chandrapala was only 64. He was loved and popular, and he has left behind a grieving family.